Welcome back to another video. This time, as I said in last week's video, I'm going to be describing the process that a donor goes through for bone marrow donation and the patient's experience, things like that. I obviously haven't had one done myself, but I've spoken to people who have, and also, you know, in the profession, you know of what happens and stuff. But so here we go. Also, I don't know if you noticed, but I've got different hair today. Decided to wear my wig for a change it up a bit. I might do a video on my wigs one day for you, so you can see, because I've got like 6 different styles, which I sometimes wear, sometimes don't. It depends how I feel, really. But anyway, enough of that. Let's get to the donor explanation video. So hope you enjoy. First of all, I want to say how important it is to join the Bone Marrow Register. I know I said this in the last video, and obviously I linked the websites that you could go to donate. Well, I say donate to, register to become a donor. It's so important, it's so easy to do, and so many people just need these donors. So it's really important, go and do it, it's so easy, and I'll try and explain now. I'm pretty sure it isn't painful if you are chosen to be a donor, so just go for it. I would be, but obviously I can't because I'm the one who needs the donor, so, well, there we are. If you're chosen to be a donor for someone, most of the time it's either people who have cancer, who have some other condition, bone marrow condition, like aplastic anemia, for example, or it is mainly if you've got some form of cancer that you need either a stem cell transplant or a bone marrow transplant. Okay, I will explain them two for you now. Stem cell donation is one of the forms of donation that you can do. Your doctor will decide which one is best for you, whether you need the stem cell or the bone marrow. Sometimes if you need a stem cell transplant, you can actually use your own stem cells, and you'll go through a process, and then you have your own stem cells given back to you, so you don't actually need a donor. But that's totally different. Well, it's not totally different, but a difference to what I'm going to try and explain to you today. If you do get chosen and called up saying that you have become a match for somebody who needs a bone marrow transplant, so these are the steps that you'll probably have to go through, okay? First of all, they'll obviously make sure that you're in good health to do the transplant and to go through the procedure that's needed to take the sample from yourself. So you'll have to complete a thorough health questionnaire first, just in case something's changed since you applied to be a donor and well, everything like that. So they want to make sure everything is fine on your side before actually taking anything from you to give to the actual patient. Then you'll have to, if everything's okay with that questionnaire, you'll have to participate on an informal session. So basically the doctor, nurse, whoever you'll be speaking to will go through any risks, make sure you know what you're in for, basically. They'll go through any risks, any side effects that you'll be looking at having after, and things like that. Basically just take you through what's to come. Then you'll have to sign a consent form, basically just consenting to the whole process, saying that you're happy with what's going to be happening and all that. It's self-explanatory, really. Then you will undergo a physical examination. Well, physical exam to make sure again that you are in good health. So they'll do an ECG, so that's to check that your heart and everything is okay. Also an echocardiogram, so that's to make sure that all the valves and everything like that are working as well. You'll also be having x-rays and maybe CT scans just to make sure that everything internally is working okay, that there's nothing wrong with your kidneys or your liver or anything like that. Just to make sure everything is fine before you go ahead with this transplant. Then you will give blood samples. I think, from what I know, you'll be given quite a lot of samples to make sure that everything matches up, everything with you is fine, and there's nothing wrong with your blood at all, basically. And then you donate. So I'll go through the donation process now next. If they've contacted you and they've said that they need stem cells donated from you, if you need stem cells donated from you, then I think it's a bit of an easier way of giving, of donating, because it's a non-surgical procedure. It's usually done in the hospital in like an outpatient setting. A stem cell donation, so 5 days leading up to the actual day that you'll be donating these stem cells, you'll be needing to take injections. I think you take them once a day. They're called filgrastim injections. I see these all the time, but I can never say the word. These increase the number of blood forming cells in your bloodstream, so it'll help in the stem cell donating process. Then on the day that you're going to donate the stem cells, the blood is removed through like a line, like maybe a cannula. I think you'll have a small needle in your arm. You're then is removed through the needle, passed through a machine that will then collect the blood forming cells that you've produced. Okay, hope you're with me on this, because I'm learning all this myself as well. The session of donating stem cells itself can take up to 8 hours, I believe. So it's a day case, and I think you can go home then afterwards, because you should be feeling okay. Side effect of stem cell donation then, you could have headaches, bone or muscular aches. This could go on for a few days, but these are more side effects of the filgrastim injections, which will then go away shortly after the donation. Most donors have said that they've recovered within 7 to 10 days post giving the donation, so it's not so bad. And then you make full recovery then, and you've helped someone by donating your stem cells. The next one is the bone marrow donation. This is a bit more extensive maybe than the stem cell donation. So this is actually a surgical procedure which takes place in an operating room, with obviously professionals doing it. They withdraw liquid marrow then, right, from both sides of the back of your pelvic bone, right? So it's quite nasty in the back, but you'll be under anaesthetic, so you won't feel it. So it's it won't be so bad for you. So you'll be under general anaesthetic, and once you wake up, it'll be done, and these cells would have gone and helped somebody else then. After donation, your liquid marrow will then be sent then, obviously, to be processed. I'm not sure what they do after donation, and then it'll be taken to the patient then, so they can have their bone marrow transplant. Sometimes, with bone marrow donation, sometimes the patient has to stay overnight, depending on the time that they actually do the procedure, time of day. So, and obviously they got to check their observations, make sure everything's fine. So sometimes they keep them overnight just to keep an eye on them, and then most of the time they go home the next day. Sometimes they go home the same day, as long as everything's okay. Okay, so possible side effect with a bone marrow transplant, or the bone marrow donation then, I should say. So there's hip or back pain, probably from where they've taken the marrow. I can vouch, after having a bone marrow biopsy, the back pain is, and the leg pain can be quite sore, I'd say, for a few days afterwards. Fatigue, sometimes throat pain, I don't know what causes that, muscle pain, insomnia, headache, dizziness, sometimes loss of appetite and nausea. That's probably from the anaesthetic though, more than anything. But the full time of recovery for marrow donations up to 20 days, I believe. So it's a bit longer, but at the end of the day then you would have done something really good for somebody and help save a life, so it's brilliant. Well, I think now I'm going to talk about what the patient then goes through when they receive the donation, the transplant, the bone marrow donation, okay? So obviously they have to have tests done beforehand just to make sure they are strong enough to receive this, because for a week before they have the transplant, they have to have chemotherapy or radiotherapy, but I think it's mainly chemotherapy, right? It goes through a Hickman line which goes here, one of the sides goes up here, similar to a PICC line, but it just goes in a different area. They have chemotherapy through there, quite a nasty form. I think it's really strong chemo. That then destroys all the existing cells that they have in their marrow, in their bone marrow. They also destroy any existing cancer cells, if that's what they're being treated for. They also stop your immune system from working, okay? So that's called the conditioning process. Once the conditioning process is done, it usually lasts up to a week. Once that's done, the transplant then will be a day or two after that, okay? So it's quite quick. So the transplant itself will take a few hours, we'll say a day, for everything to go through. And how they do it is through the same line with the chemo, I believe, so through the Hickman line it's called. Then you go into recovery, right? So you're in hospital having this done. When you go into the recovery stage, it means you're usually in hospital for a few weeks more, sometimes months, depending on how well you recover, okay? So when I was supposed to go for it, they told me I'd be in for, I think, 5 to 6 weeks in total. And I do know people who have been for 6 weeks and sometimes longer, okay? I obviously didn't go in the end, but because I had something different. But make sure if you are going for this, you've got loads of things to keep you occupied in hospital, because it can get quite boring and quite lonely and things. During the recovery time, the nurses and doctors will be monitoring you daily, taking daily bloods, maybe twice a day, depending on what your blood results are. And they'll be checking to make sure that your bone marrow has started working again by itself and that this transplants work. You'll be on certain medications to help your bone marrow work. So sometimes you'll be on immunosuppressants, not quite sure what else you'll be on, like anti-rejection meds maybe, things like that. Yeah, so they'll be looking out for signs of any infection, because you've got a really high risk of having infections. So you will be in an isolated room by yourself, so you won't be with any other patients, and anybody coming in or out will have to make sure that they're wearing correct PPE, and obviously making sure that they're washing their hands when they leave and enter the room and everything like that. You may need transfusions after the transplant. Very likely you will need platelet or blood transfusions just to help get your numbers back up, because everything is going to be quite low with you. And other than that, then it's just the waiting game for everything to get better and for the doctor to be happy enough for you to be able to go home. And obviously when you're at home, you'll still have to be really careful and basically, isolate, I think, because you're still at risk of obviously catching infections and everything like that. And if for some reason the transplant doesn't work, then obviously you're still going to be very unwell. So yeah, so that's the process the donor and the patients go through usually. Like I said, I don't know, the exact ins and outs. I didn't actually go through it, but this is what I know from speaking to people I know who have been through it, and obviously reading up on it throughout the time when I thought I needed one. So this is just information that I've learned. Well, that's that explained to you. I hope that makes sense, because obviously sometimes it doesn't, and sometimes it doesn't make much sense to me actually, but I hope you enjoyed that. If you do want to see more things like this and nursing type videos, let me know, because I've got all the time in the world at the moment, so I'm willing to do it. Also, I wanted to say, obviously I want to encourage everyone as well to become donors. Not everyone, but like, the more people we can get on the donor register, the better it is for these patients who need it. I want to say how important it is to donate blood and platelets as well, if you can do it, because that's an easy process as well. It doesn't take that long at all to do, and then you've donated blood and platelets to somebody who needs it. I just want to add in as well that not everyone that actually registers to be a donor actually gets called up one day to be a donor. It's good that they're on the list, so if somebody out there that's the same tissue type or blood type as you needs it, then it's great. But the chances of donating is actually 1 in about 430, I think. Like I said, if you're on that list, you're on it, and you could potentially help someone, so it's really good. So I would really highly recommend people do it. I wish I could do it, but like I said, at the moment I can't. There's another video. Thank you very much for watching. I will link again the Anthony Nolan, the DKMS website, and if I can find anywhere that people need information about transplants or donating blood or platelets, I'll link everything down below, just so people are aware of it and can have a look if they want to. Please like and subscribe if you want to, but it really helps me if you do, because obviously more people will see these videos then, and hopefully it can help people out there. So thank you very much again, and I'll see you in the next one. Bye.